Hi and welcome to our telehealth video information series. I'm Garvin and this video is on Colifoam Rectal preparation. So what is Colifoam Rectal used for? It's used for inflammatory disease of the large intestine, which is ulcerative colitis, and inflammation of the rectum or proctitis, and inflammation of the rectum and lower bowel. So how does Colifoam work? Colifoam contains the active ingredient hydrocortisone, which is a type of a medicine known as a corticosteroid. Corticosteroids are hormones that are produced naturally by the adrenal glands. They have many important functions in the body, including control of inflammatory responses. Corticosteroid medicines are man-made derivatives of the natural hormones. They are often simply called steroids, but it should be noted they're very different from another group of steroids called the anabolic steroids. And they have gained notoriety because of their abuse by some athletes. Hydrocortisone is a synthetic steroid that has an anti-inflammatory effect. It is used to decrease inflammation in various different diseases and conditions. Hydrocortisone decreases inflammation by acting within cells to prevent the release of certain chemicals that are important in the immune system. These chemicals are normally involved in producing immune and allergic responses. By decreasing the release of these chemicals in a particular area, inflammation is then reduced. This can help control a wide number of disease states characterized by excessive inflammation. Coliform is administered into the rectum to reduce inflammation associated with inflammatory bowel disease, ulcerative colitis. The hydrocortisone acts locally to reduce inflammation in the lower end of the bowel and the rectum. It helps relieve the symptoms of flare-ups of the condition. So the foam is administered into the rectum once or twice a day for 2 to 3 weeks, and then once a day, and then every other day. Once the inflammation in the bowel is stable and under control, your doctor will tell you to stop using the medicine. Continuous long-term use is not recommended because this can result in significant amounts of the medicine being absorbed into the bloodstream and increases the chances of side effects on the rest of the body. Coliform should be used with caution in children, elderly people, decreased kidney function, liver failure, peptic ulcers, and severe ulcerative colitis. So regarding pregnancy and breastfeeding, when administered for long periods or repeatedly during pregnancy, corticosteroids may increase the risk of slowed growth in the developing baby. As a result, this medicine should be used with caution during pregnancy and only if the expected benefit to the mother is greater than any possible risk to the baby. The medicine may pass into breast milk, although doses of up to 160 milligram of hydrocortisone daily in the mother are unlikely to have any effect on a nursing infant. So if this relates to you, if you're breastfeeding, speak to your doctor before using Colifoam. Possible side effects of Colifoam. So medicines and their side effects can affect individual people in different ways. The main side effects associated with hydrocortisone used in the rectum is local irritation. Although administered locally into the rectum, the hydrocortisone in this medicine could also be absorbed into the bloodstream, particularly when the bowel is inflamed. Continuous long-term use is not recommended because this can result in significant amounts of medicine being absorbed and increases the chances of side effects on other areas of the body. So the following are some side effects that are known to be associated with corticosteroids that have been absorbed into the bloodstream. Raised blood sugar level, increased appetite and weight gain, increased susceptibility to infections, and increased severity of infections, and effects on the gut such as indigestion, bloating and nausea, and inflammation of the pancreas, ulceration or thrush infection in the throat, and thinning of the bones, and increased risk of breaking a bone. So the effects on the skin such as skin thinning, impaired hearing, acne, and change in pigmentation. Also, the side effects that I've just mentioned does not include all the side effects reported by the manufacturer for this medicine. For more, you need to read the patient information leaflet that comes with the medicine, or speak to your doctor or pharmacist. So how can coliform affect other medicines? Hydrocortisone can cause fluid and salt retention, and so may oppose the effects of antihypertensive medicines used to treat high blood pressure, so diuretics and furosemide. Hydrocortisone may increase blood sugar levels and so may oppose the blood sugar lowering effects of antidiabetic medicine. People with diabetes may need to increase their dose of insulin and or antidiabetic tablets, so your doctor will advise you on this. There may be an increased chance of the level of potassium in the blood falling too low if hydrocortisone is used in combination with any of the following medicines, which can also lower the amount of potassium in the blood: acetosalamide, amphotericin, beta agonists such as salbutamol, which is Ventolin inhaler, salmeterol, which is Ceravent, and terbutaline, which is Bricanol, carbenoxolone, potassium-losing diuretics such as furosemide and bendrofluozide, and theophylline. If the level of potassium in your blood falls during treatment, this can increase the risk of side effects on the heart caused by a medicine called digoxin. Hydrocortisone may enhance the anti-blood clotting effect of anticoagulant medicines such as warfarin. People taking anticoagulant medicines in combination with hydrocortisone should have their blood clotting time, or INR, regularly monitored, particularly after starting or stopping treatment with hydrocortisone and after any dose changes. If hydrocortisone is used in combination with non-steroidal anti-inflammatory drugs such as ibuprofen, there may be an increased risk of side effects in the gut, such as stomach ulcers and bleeding. Hydrocortisone may decrease the blood levels of salicylates such as aspirin. When hydrocortisone is stopped, this may result in excessive levels of salicylate unless the dose is adjusted. And hydrocortisone may decrease the body's immune response. This means that vaccines may be less effective if given during treatment because the body does not produce sufficient antibodies. Live vaccines may cause serious infections. So live vaccines include measles, mumps, rubella, the MMR and BCG, chickenpox, oral polio, and oral typhoid. So these should not be given to people whose immune system is underactive due to treatment with this medicine. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into us at Lynch's Pharmacy, Douglas, Cork, or call us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.